Hi everyone. So this is my another lecture in endocrinology that is about hypothyroidism. In my previous lecture, I talked about how the patient clinically present with hyperthyroidism. Now today I will talk about how hypothyroidism patient clinically present. Then after that I will talk about the causes of hyperthyroidism and then I will go into detail. So the hypothyroidism patient clinically present with gain weight, increased body mass, and the slowness of the speech and movement, and dry ears, and cool periphery, hands and legs will be cool, and dry skin. On examination, we will found on slow pulses and periorbital swelling like mixed edema. Like in that picture you can see, this is what we call periorbital edema. That periorbital edema can be due to nephrotic syndrome, in which there will be protein losing from the kidney, can be protein enteropathy, like protein unable absorbed from GIT tract due to any inflammation in the GIT. So thirdly, there can be congestive cardiac failure. So this is about, and liver cirrhosis or liver failure. So it is a causes of periorbital swelling. So one of the cause can be what hypothyroidism, that how the hypothyroidism patient present. And then there will be a non-pitting edema within the pre-tibial area. Patient present with the pre-tibial area edema, like in that way, that this is the pre-tibial area patient present with non-pitting edema. So this is how the clinically patient present with hypothyroidism patient. So in the hypothyroidism patient, there will be a slow reflexes like ankle reflex or knee jerk reflex. Their reflexes will be slow, bicep reflex, tricep reflex, that all reflexes will be slowed down. So this is how the clinically patient present. Secondly, the symptoms of the patient present with weight gain and increased sleep. And increased sleep, in the hyperthyroidism there will be decreased sleep, but in the hypothyroidism increased sleep, constipation, tiredness, and intolerance to cold. Patient unable to tolerate the cold weather, but hyperthyroidism patient intolerance to warm weather, but in the hypothyroidism patient unable to tolerate the cold temperature. Now I will talk about the causes of hyperthyroidism, that how the what are the causes of hyperthyroidism. In my previous lecture I just talked about how patient clinically present if he or she have hyperthyroidism. Now I will talk about the causes of hyperthyroidism. The most important cause of hyperthyroidism is what? Graves' disease. So mostly thyroid problem is common in female as compared to male. So in the female ratio is more than male ratio. So Graves' disease is very common in female, which is an autoimmune type. It means what? Autoantibodies form against the TSH receptor on the thyroid gland. So when TSH receptor will be stimulated more and more, so more and more thyroid hormone will be produced like T3 and T4. Then second cause will be what? Hashimoto thyroiditis. In the Hashimoto thyroidism, what happens? There will be initially there will be inflammation, and then there will be more and more T3 T4 in the circulation, and initially there will be a thyrotoxicosis stage, mean what? Hyperthyroid stage. Then later on all the cell of thyroid gland leaked the thyroid hormone into the circulation. Then patient present what? Hypothyroidism. So this is very important. In the Hashimoto thyroiditis, inflammation of thyroid gland. So initially there will be thyrotoxicosis, mean what? Hyperthyroidism phase. Then there later on there will be what? Hypothyroidism phase. Then there will be toxic adenoma, like any benign tumor which are releasing more and more T3 and T4. Then there will be toxic multinodular goiter, in which thyroid gland cell size increase. So when cell size increase, more and more T3 and T4 is produced. Then there will be decurrent vein thyroiditis, that is mostly associated with viral infection and infection of thyroid, radiation thyroiditis. Then there will be postpartum thyroiditis, after pregnancy postpartum thyroiditis. Then there will be drug induced thyroiditis. So this is about the causes of hyperthyroidism, but most important cause is what? Graves' disease. So in my next lecture I will continue my this lecture. Thank you for up to now.